Hello, everyone, and welcome to this week's lecture where we continue our discussion of the book Fertile Matters and also Chapter 30 in Chicana Feminist Thought on the Politics of Reproduction. So this section of the book begins talking about John Tanton and the Zero Population Growth Organization. And you can really see sort of the influence that this one person has had over decades, starting with seemingly in favor of things like Planned Parenthood and open to working with feminists and so on issues of reproductive rights within his concern of overpopulation and how that ideology develops into anti-immigrant politics and organizing. So John Tanton began his career organizing around the impact of overpopulation on environmentalism. As a result, he created partnerships with environmental organizations like the Sierra Club and also with organizations like Planned Parenthood. Yet his beliefs about family size were extreme, so that the slogan, "Every child a wanted child," wasn't enough for him, because he argued that there were some people whose reasons for wanting a child are pathological. He also believed in eugenic reasons for limiting family size in order to improve, quote, "the generic characters of children within a specific family." However, just as the birth rates in the US began to slow down, the rhetoric shifted towards immigration, where now immigration was perceived as the new threat to overpopulation in the United States. The new environmentalist argument against immigration was that immigrants were going to use the natural resources of the United States that belonged to Americans. Tanton became president in 1975 of the Zero Population Growth Organization, and immigration becomes the group's main issue. Even though their membership numbers decrease, as some folks are concerned about being labeled racist, the organization was still influential because of their strong lobbying and public relations. They begin to also create additional programs and organizations to focus on the immigration issue, such as the organization FAIR. This section also includes a chapter focusing on how Chicanas have been organizing around reproductive rights and how they organize around the Madrigal versus Quilligan case. So in terms of organizing for reproductive rights, we see the organization Comisión Femenil Mexicana Nacional, which advocated for Chicana women providing testimonies to the California Commission on the Status of Women. And they also supported the Madrigal versus Quilligan case through fundraising and raising awareness in the community. The Chicana Rights Project of the Mexican American Legal Defense Fund provided legal support to lawsuits about sterilization abuse. There was also the Committee to End Forced Sterilization, which organized protests against sterilization abuse. And we also see many of these women activists participating and testifying during hearings with the California Department of Health to create regulations for sterilizations procedures. So while a lot of the focus of the textbook is on this one particular case, what we see is that Chicanas have been involved in reproductive rights issues and advocating for women's reproductive rights in multiple settings and throughout different years. So what we see in talking about the Madrigal versus Quilligan case in particular is some of the experiences that the women had in their advocacy and activism around this particular case. And what some of the significance of that activism was. One was the significance that Chicanas themselves had organizations and leaders who voiced their concerns over reproductive rights. It wasn't that other people were speaking for them, but they themselves were using their voice to organize and speak up for their own communities. Chicanas argued for the right to have as many children as they wanted, which is a different discourse than the mainstream reproductive rights one, which is about the right to limit the number of pregnancies you have, if any at all. So a lot of the mainstream reproductive rights conversation is around pro-choice, having access to birth control pills, having easy access to a sterilization if that's what you want. Whereas for Chicanas, it was sort of the opposite problem. People were trying to get them to control how many children they had. And so their activism was around having the right to have however many children they wanted, and that it wasn't the right of doctors or medical institutions or the government to determine how many children they should have. They also talk about how mainstream feminist groups like the National Organization for Women now did not support them because they were seeking a waiting period in counseling before a woman could get sterilized, and now insistent on sterilization on demand, without considering how sterilization on demand became a tool of oppression against Chicanas. And as a result of their advocacy, they're able to be successful in getting regulations created and use of bilingual consent forms. So some of the new regulations that are created include patients having to be informed about welfare benefits that are available to them, whether they get sterilization or not. Patients be thoroughly informed of sterilization procedure, risks, and permanence. Provide counseling to patients on birth control, a 72-hour waiting period between consent and procedure, and a ban on sterilization of girls under age 18. So these were among the new regulations that their advocacy was able to get put in place. Now, the reading also talks about the ongoing controlling image of the hyper-fertile Mexican women, which now manifests itself in this idea of the quote-unquote anchor baby, and the idea that Mexican women come pregnant across the border in order to give birth to citizens and access social services like healthcare and welfare. The author discusses how in California, in particular in the 1990s, the rhetoric became about how Mexican women pose a threat to the state budget through their supposed abusive use of social services, including prenatal health care, welfare, and education. And talks about how a distinction was made between quote unquote earners, which were people who earned money and paid taxes, and quote unquote users, those deemed to be users of social services, but not perceived as contributing to society. So it created, right, this language during the 1990s created this idea that were added to the idea that already existed, that Mexican women are just sort of here to take, right, to take resources, to take services, and that there is no way in which they contribute to society. So this was the political context in which Proposition 187 made it to the ballot in 1994 in California, which called for the barring of undocumented immigrants from receiving public entitlements and services, non-emergency health care, welfare, and public school education, and discusses how challenges to birthright citizenship are also not new, but existed in the 1990s as part of Governor Pete Wilson's anti-immigrant rhetoric. So in the last few years, particularly under the Trump administration, we heard a lot of conversation around whether birthright citizenship should be upheld or not, meaning that people who are born in the United States are automatic citizens, right? And so a lot of the anti-immigrant rhetoric was, and especially in relation to the supposed anchor baby problem, was that we shouldn't have birthright citizenship be something that's automatic, and particularly for immigrants, right? That their children who are born in the United States should not automatically have American citizenship. Now, that's something that was being thrown around during the Trump administration, but as you can see here, that was not new, right? This is something that has been put forward at other moments, and in particular during this time period in the 1990s in California. And so the reading talks about the impact this had on women. In one Texas hospital, security guards wore uniforms that were very similar to those of Border Patrol as a way to intimidate undocumented women from going to the hospital. Additional measures taken include the example of San Diego that was talked about in the book of the Department of Health, which discontinued ads in Spanish about Baby Cal, a state-funded perinatal services available to low-income women. This thus impacted Latina Spanish-speaking legal immigrants as well, not just a deterrent for undocumented Mexican women. And concludes with the alarming story of the woman who wanted assurances that if she had her baby, she would have access to Medi-Cal. And if they could not give her these assurances, she was going to choose abortion. So you see her in the book talk about these examples, right? These incidences of how this environment of talking about these women in this negative way, right? Talking about them as people who come and just take advantage of the system, right? Ended up having a real impact on women who needed certain services and the ways in which that they were intimidated away from services that they, especially legal immigrant women, had a right to. Have a wonderful week.